Hello, everyone. For those of you who don't know me, my name is Malika Medina, and today I'm going to be sharing with you all my proposal idea of vagus nerve stimulation as a potential treatment for opioid withdrawal. Beginning with a brief overview, I will be starting off with some background information, while tying in some significance and justification with that as well. Then I'll be moving on to my research question and hypothesis, my specific aims, and my experimental design. I will then end it all with tying everything together into a short summary. All right, so let's begin with opioids first. Opioids are frequently prescribed as a standard treatment for chronic pain. However, misusing them can lead to addiction, tolerance, and dependence. There are people who use the prescribed opioids as intended and receive help from chronic pain, but there's an alarming amount of people who misuse prescribed opioids or illicit opioids. Even those who are using opioids as intended can create an addiction with prolonged use. According to the National Center for Drug Abuse, 10 million people per year will misuse opioids, and approximately 50,000 people per year will die from opioid overdose. Misusing opioids can lead to opioid use disorder, which is a disease that stems from the physical and psychological reliance of opioids. In 2017, the U.S. Department of Health and Human Services declared a public state of emergency known as the opioid epidemic. However, this is an ongoing public health concern as withdrawal from opioid use disorder is very hard to manage, and new illicit opioids like fentanyl are becoming more and more detrimental. Speaking of withdrawal, most symptoms are not going to put the body in danger of dying. However, they are incredibly uncomfortable to manage and get past, which is why a lot of people can't stay clean. As mentioned with opioid use disorder, there is a physical and psychological reliance on the opioids, and when someone stops taking them, the body has to readjust. This leads to the early symptoms of drug craving, anxiety, muscle aches, stomach cramps, and more, and the late symptoms of tachycardia, hypertension, dilated pupils, and more. Most withdrawal symptoms will resolve within 2 weeks, especially if a doctor is involved. However, withdrawal symptoms vary by person, drug, and duration of addiction and can actually last for months or even up to a year. I briefly mentioned a doctor being involved in opioid detox, and that leads to current treatments of opioid withdrawal management. There are currently three main opioids used: buprenorphine, methadone, and naltrexone. They all have mild opioid effects that prevent the body from experiencing withdrawal. As you can see in the picture, it shows how the opioids are occupying the receptors. There is another form of medication, commonly called lofaxidine, which is not an opioid. What this medication does is it blocks the release of a hormone called norepinephrine, which is similar to adrenaline. And what this does is it helps with the experience of withdrawals. Of course, there is home management with plenty of rest, hydration, and therapy groups. However, most of the time, these withdrawals are way too painful to manage on your own at home. As you can see, the current treatments are not great because the body can still become dependent on the opioids used to help, and there can be severe side effects with lofaxidine on your heart and blood vessels. There is definitely a need for a quicker, more universal, and easier treatment for withdrawal symptoms because, to be honest, most people don't seek help from doctors when trying to get clean. There are opioid receptors found in the digestive tract and the central nervous system. Therefore, using opioids induces changes to both the brain and the gut microbiome, which are connected via the vagus nerve. The communication between the gut and the brain is bidirectional. And as you can see in the picture, there is a lot of interactions between the two. Both changes to the gut microbiome and the central nervous system have health concerns of their own. But for the sake of this research, I focused on how the changes affect the vagus nerve and thus resulting in addiction, tolerance, and dependence. Now that we have a better understanding of how opioids affect the brain and gut microbiome, let's focus on vagus nerve stimulation as a whole. Vagus nerve stimulation is currently FDA approved for clinical therapeutic use in patients 12 years or older. There's also current research done with vagus nerve stimulation and how it improves epilepsy, heart failure, migraines, depression, inflammatory bowel disease, and more. There are two different techniques used, which are invasive, surgically implanted, and non-invasive, transcutaneous. As seen in the picture, the most common is this device that is similar to a pacemaker, sending pulses of electrical currents to the vagus nerve. My main goal here is if vagus nerve stimulation does improve the symptoms of withdrawal, is to have something like a pacemaker or even a hearing aid for more functionality, in which patients with opioid use disorder can receive assistance when experiencing withdrawal symptoms. This overall leads me to believe that vagus nerve stimulation can potentially save the lives of users all over the world and provide hope to those who have tried to get clean. That leads me to my research question and hypothesis. My research question is, since the gut and brain connect via the vagus nerve, and there have been prior successful research on vagus nerve stimulation, if there was a functional device that provides relief to patients experiencing opioid use disorder symptoms, would more people get clean? And my hypothesis is that if the gut brain axis is responsible for addiction, disease susceptibility, and withdrawal symptoms with opioid dependence, then vagus nerve stimulation will improve withdrawal symptoms. My three specific aims are: one, to compare various opioids and their effect on the gut brain axis with brain activity and gut dysbiosis; two, determine the most disruptive opioid in terms of brain activity and gut dysbiosis; and three, determine if vagus nerve stimulation can reduce the symptoms related to opioid withdrawal. Just as a quick vocab, gut dysbiosis is any imbalance in the gut microbiome. As we discuss the experimental designs for each specific aim, since animals will be utilized in the study, all animal welfare laws and Colorado animal testing requirements will be followed, as well as personnel who is licensed to prescribe will also be supervising and handling all controlled substances that are utilized. To begin, there will be 4 different groups containing 4 mice per group. One group will be receiving morphine, one codeine, one Percocet, and one saline as a control. They will all be administered via IP injection, as you can see in the picture, and receive an increasing dosage over the course of 7 days, starting at 0.3 milligrams per kilogram to 15 milligrams per kilogram per day to create dependence in the mice. Although human subjects would provide accurate data, most of our understanding actually comes from preclinical rodent studies in terms of like the gut-brain interactions in addiction-related behaviors. A small animal PET scan of the brain will be used to visualize the brain activity, dopamine reward system, and opioid receptors. And a 16S rRNA sequencing using a nanopore platform will be used to visualize the changes in the diversity of the gut microbiome. Both will be done before and after injections to observe the effects of the opioids. The information from AIM-1 will be used to determine the most disruptive opioid in terms of the brain activity and gut dysbiosis. In terms of brain activity, the most disruptive opioid will show baseline binding, which is a reduction in binding due to released neurotransmitters occupying the receptors. As you can see in the picture, the dopamine activity in the recovering brain is much higher than that of the user's brain. And you can see that the areas of activity will actually come up in yellow and red colors, whereas like the green and the blue are less activity. In terms of the gut, not only is it responsible for also producing some neurotransmitters, but disruption to that diversity can actually induce various health concerns. Given the disruption to the brain and gut microbiome, vagus nerve stimulation will be utilized. The most disruptive opioid is chosen due to the complications of vagus nerve stimulation as seen in the picture. It would be kind of hard to do every single group and implant the vagus nerve stimulation. So I have decided to do just one group as well as the control group. Here I will monitor the withdrawal symptoms closely, as the vagus nerve stimulation will be done for 5 minutes per day for up to 2 weeks to observe the changes. Withdrawal symptoms in mice include anywhere from jumping, shaking their forepaws, shaking like a wet dog, rising on their hind legs, and any abnormal changes to their defecation. At the end of the day, opioid use disorder affects millions of people all around the world, not just in the United States. Opioids affect our brain and gut, leading to dependence, addiction, and tolerance. all of which result in withdrawal, making it increasingly difficult to get clean. There is a need for improvement in withdrawal management and vagus nerve stimulation, and vagus nerve stimulation can possibly do that. Here are some acknowledgments to my peer reviewers and Dr. Musa in helping me perfect my proposal. And my references. Thank you all for taking the time to listen, and please reach out if you have any questions.